Now there are different side effects of beta lactamases, and side effect, these are the known effect, these are the you can say these are, we can't say these are the unwanted effect. These are predictables, like side effect GIT, it may cause GIT upset, rashes, resistance and allergic reaction. Anaphylaxis and most common routes of administrations per oral, that is rare, and IM intramuscular as well as IV. So we can administer, this is the route of drug administration, mean these drugs can be administered through oral route or parenterally, as I have mentioned. Now the beta lactam antibacterial agent cephalosporin, this is another class. Cephalosporin, basically this is broad spectrum antibiotic in widely used group of drugs similar to penicillin structure. This is the most widely used drugs, especially they are used in the variety of infection. And it has broad spectrum activity, it means it can carry a wide range of microorganisms. Cephalosporin, they are used and the treatment of, you can say, infection like septicemia. Sepsis mean when there is some toxins or bacteria, presence of certain toxin and bacteria in your bloods, and as well as in meningitis, inflammation of the triplet layer of the brain, surgical prophylaxis, and hepatobiliary infection, chest infection such as pneumonia. So these are the different type of indication, and cephalosporin is used and the treatment of variety kinds of infections. Its major side effects are diarrhea, abdominal cramps, and prolonged blood clotting times. Mean thrombin and prothrombin, as well as it increase the bleeding tendency. So mean this drug is also responsible for what renals, you can say, impair platelet functions, and you can say deranges vitamin K synthesis, nephrotoxicity and allergic reactions. As in previous lecture, we have discussed that there are some patients, a patient who is allergic to penicillins, and then you can use the alternate brand. So, and it is also not necessary that each and every drug will be available in the market. There are some drugs which are still under investigation. So here we can say the cephalosporin causes diarrhea, abdominal cramps, prolonged blood clotting time, and increasing the bleeding tendency. So mean this is also you can say very fatal conditions. So these are side effects. It is not necessary, but there may be chances of it may enhance the bleeding tendency, like it may directly or indirectly affect your platelet function, and like vitamin K synthesis, it may reduce vitamin K synthesis, it will be also affected, while nephrotoxicity and allergic reaction. Routes of administration, so it is very simple orally, so they are available and different dosage form. So we can say they are also available, we can be administered as parenterally, IM intramuscularly and intravenously. Okay, now look at here. These are the beta lactam antibacterial cephalosporin. Look at here. These are the first generation cephalosporin, second, third, and fourth generation cephalosporin. So I would like to differentiate between first generation, second generation, third, and fourth. So here, first generation cephalosporin are basically those antibiotics which have a strong gram-positive. They are active against gram-positive bacteria, gram-positive microorganism. So it means that the first generation and first generations, the gram-positive activity is greater. For example, you can say if we compare why these antibiotics are classified into different generations. So it means that the gram negative activity, when we are going from left to right, mean from first, second, third and fourth, mean that fourth generations they have a strong, they possess a strong bactericidal activity as compared to third, and third generation mean they are more active against gram negative bacteria as compared to second generation cephalosporin, while the second generation cephalosporin, they are also active against gram negative bacteria as compared to first generation cephalosporin, mean that first generation cephalosporin they are only active against gram positive. So it means that whenever we are going to increase the generation, so it means the activity of that antibiotic will be increased, mean the gram negative activity, the bactericidal activity is increases from first generation to four generations, while the bacteriostatic activity, or you can say the bacteriostatic or narrow spectrum activity had become increased from fourth generation to the first generation. So here first generation they are effective against gram positive bacteria. For examples, parental, there are certain drugs which are available and which are available in the form of injections. You can say Cephalosporin. They are available in a market by a trade name Capzoles. Orally, they are also available orally by a trade name Caplex Cephalosporin, while Cypridines they are available in a market by a trade name Velocip. So they are used for the prevention of surgical infection. Second generation cephalosporin, they are active against gram negative bacteria, and simple we can say the classical example, that is word cefuroxime, which is available in a market by a trade name Zenacep, and they are available parenterally, while they are used in the treatment of pneumonia, otitis, sinusitis and RTI, respiratory tract infection. And third generation cephalosporin, broad spectrum, they are actually broad spectrum antibiotics, so they are highly active against gram negative bacteria. For example, parentals, they are also available in the form of injection like cefotaxime. Cefotaxime, it is available in a market by a trade name Cleforons, or you can say ceftriaxone. Ceftriaxone, basically this is the generic name, and it is available in a market by a trade name Rosepen. And the next one, that is orals, orally recommended, that is Cefotaxime, which is available by a trade name Cephalosporin, and they are used against meningitis, gonorrhea, you can say influenza and typhoid. It means that the fourth generation cephalosporin, it has broadest spectrum of activity. It means that the fourth generation cephalosporin, they are much and more effective against gram negative, and these are highly active against gram negative bacteria. And the best example of fourth generation cephalosporin is gram, you can say CP5, which is available in a market by trade name Maxipine, and you can say Cypiroms. And these drugs, they are very active against septicemia and hospital acquired pneumonia. So this is a general classification. If you look this chart, so you can easily identify that which antibiotic is more effective against gram positive and gram negative, and which one of the following antibiotic has broad spectrum activity. So it has clear from this chart that which antibiotic is used in that particular condition. So they are very easy to understand. And this is the classification of cephalosporins, generation of cephalosporin, parental and orals. This is just the classification of cephalosporin. So in first generation, look at here, parental cephalothene and cephalosporins and scala, and you can say cephazolines. While and orally, those drugs which are available orally, that is cephalexin, Caplex and cepodroxel, which are available by trade name Duriceps, oral and parental Cyprodin, while in second generation parentals, cefamycins and cefoxitin, cefotetrans and Syphilis. So all these drugs like cefuroxime's orals, which are these are the orals drugs like cipiclor and ceproxils. So as we have already discussed that these are the drugs which are available in the market, but it is not necessary that each and every drug will be available in the market. Now the here look at this chart, inshallah, and next lecture I will try my best to highlight the dose of each and every drug so it will be easy to understand. And thank you so much for watching this lecture.